This screencast is going to review the locations of the veins. From the heart earlier, you should remember superior and inferior vena cava, and you should also remember the pulmonary veins. Also remember that veins take blood to the heart and away from organs or regions. So again, a common question is for me to ask you, what blood vessel takes blood away from the head? Then you need to name the veins that take blood away from the head back to the heart. So again, it's very important that you listen to that podcast that reviews the locations where these veins take blood back from parts of the body or regions. All right, let's start here. Here's your superior vena cava. You should remember where the inferior vena cava is from the last lab. Here are what are called the Brachiocephalic veins. So unlike the artery where there's only one brachiocephalic artery, there are two Brachiocephalic veins. They'll bring blood back from the arms and legs into the superior vena cava and then back to the heart. So the Brachiocephalic veins are here. So if it's here, superior vena cava, if the pointers here or here, it's Brachiocephalic vein. Now what will bring blood back from the head? Here's your Brachiocephalic veins. There are two what we call jugular veins, the internal jugular and the external jugular. The external jugular is closer to the surface, it's superficial. The internal jugular is deep. The internal jugular actually has a significantly larger diameter, which allows it, which is why it's used for embalming. So if you actually go through the sternocleidomastoid, cut through that muscle, you get to the internal jugular vein, and that's where a lot of embalming is done. So your external and internal jugulars branch back into the Brachiocephalic veins, into the superior vena cava, and then back to the heart. Right after the jugulars, we have the subclavians, and again, you've heard of those. The subclavians are going to bring blood back from that clavicle area. At the armpit area, you have the axillary veins. So the same names as you saw in the arteries. And when you get to the arm, you come from the axillary, you go down, and you have the brachial vein. The brachial vein comes down the center, just like the brachial artery did. And then you have the radial and the ulnar veins, which run again along the radial and ulnar arteries. So those are going to be the same. What you're going to see with veins is you're going to see that there are more veins than there are arteries. And part of the reason for that is that's going to help the veins bring blood back to the heart without having a pump. And we'll talk about that in lecture. So you're going to see two extra veins in the arms that you have to know. This one that's very lateral is the cephalic vein. So it goes cephalic vein, brachial vein, and then the most medial in the upper arm is the basilic vein. So cephalic, brachial, basilic. And that's where you need to know them. So lateral, the brachial goes down the middle, the basilic is the most medial. The other one you need to know that's different from the arteries is what's called the median cubital vein. The median cubital vein. And it will bring blood back from the elbow. So again, your superior vena cava, your brachiocephalic vein, subclavian vein, axillary vein, cephalic, brachial, basilic vein, median cubital vein, radial vein, and ulnar vein. Let's do the same thing we did for the arteries, coming down now from the inferior vena cava. We have the renal vein, which bring blood back from the kidneys. We also have, which are not on here, the superior and inferior mesenteric veins. So the same principle applies. If I ask you what brings blood back from the upper portion of the intestine, your answer is the superior mesenteric vein. Lower intestines, inferior mesenteric. Now there's one vein that I will not point to on anything, and that is the hepatic portal vein. It does something unique. It brings nutrients from the intestines to the liver. So nutrients are going to be absorbed by your intestines and taken through the hepatic portal vein from the intestines to the liver. Okay, from the intestines to the liver. All right, so we got the renal, superior and inferior mesenteric, hepatic portal vein. Then you come down here, again the inferior vena cava branches into the common iliac vein. the external iliac vein, and the internal iliac vein. So those run along the same portion of the body as the common iliac arteries. But remember, we're taking blood back to the heart, so the blood is flowing this way. Coming to the leg, you come off that external iliac vein. Just like with the artery, it becomes the femoral vein. Down at the knee, it becomes the popliteal. It then branches into the anterior and posterior tibial veins, which, just like the arteries, run on the medial side. You come down off the anterior tibial and you come to the dorsal venous arch, which is on the top portion of the foot, and then you have the plantar arch off the posterior tibial that goes to the bottom of the foot. So again, those are very similar to the arteries that you learned. Now there's added veins in the legs, like there was added veins in the arm. The great saphenous vein, notice here's the top of your femoral. The great saphenous vein comes off that femoral vein and goes all the way down the medial side of the leg, all the way down to the foot. So you see it here on both legs. It comes off the femoral vein and it brings blood back from the whole medial side of the foot, or leg, from the foot all the way to the leg, and then branches back into that femoral, into the external iliac. You also have what's called the small saphenous vein. The small saphenous vein is going to run the most lateral, even more lateral than the fibular vein. Even more lateral than the fibular vein. The small saphenous vein comes off the popliteal and runs laterally down the lateral portion of your lower leg. So in the lower leg you have the popliteal at the knee, you have the anterior tibial, medial front, posterior tibial, medial back, the fibular vein, which runs lateral, but the small saphenous vein, which runs even more lateral than the fibular vein. In the foot, again, you've got the dorsal venous arch on the top and the plantar arch on the bottom. So again, review these locations. Again, you have some added veins, a few more veins than you did arteries. Go back and listen to the podcast and repeat them over and over again. But then make sure you listen to that podcast, which goes over where these veins bring blood back from. Arteries take blood too. Veins bring blood back from regions or organs of the body. All right, so again, make sure you review all those for your test.